Hi, I'm going to assess your apical pulse rate today, which means that I'll be listening to your heart for a full minute. Is that okay?
Yes.
Great. Let's move your gown down. Thank you. So in order to find the correct landmark, I start by looking at the patient and palpating the patient's clavicle. The first rib actually lies right underneath that first clavicle. So if I run my fingers across or over that clavicle, I find the soft spot in between, which is the first intercostal space. Then I march down and I find the second rib here. So here's my second rib, and then I find my second intercostal space, then my third rib and my third intercostal space, my fourth rib and my fourth intercostal space, fifth rib and fifth intercostal space. So now I know that horizontally here I have the correct line. And then regarding the vertical assessment, I'm looking at the mid-clavicular line. So again, I'm looking at the clavicle, and right in the middle of it, which is approximately here, I run it down and I find the axis between the two, and then so here I have my PMI. And if I actually press my fingers on it, I might be able to palpate the patient's PMI. And again, remember, depending on the patient's physical build, you may or may not be able to palpate it. In this case, I can actually feel it. And I know that my patient actually has a slow heart rate, so it's a little bit more difficult to assess. But I know that this is the correct landmark to assess my apical pulse. So I take my stethoscope and I place it right there on that apical site, and I listen to it for a full minute while I count it. After I'm done counting for a full minute, I know that this is my patient's apical heart rate, and I take care of my patient by getting them dressed. And then I am done with my assessment, and I will go ahead and record my findings.